My name is Paolo Maldonado, and I'm going to be talking about the temporomandibular joint, or the TMJ. So the TMJ is the joint between the mandibular fossa of the temporal bone and the condylar process of the mandible. So here I drew this to show the articulation of the bones. So the TMJ is right in between the condylar process of the mandible, which is this right here, the dark spot in the middle, and the mandibular fossa of the temporal bone, which is the temporal bone of the cranium. And the mandibular fossa is right, this line right here. So yeah, so the TMJ is right in between these two. So it is lateral to the aspect of the face, right here, and it is located anteriorly to the targus of the ear, which would be right here. So the anatomical movements of the mandible. So first off, it is depression, which would be like this. It's just when your mouth is open. Elevation of the mandible would be when you're in depression and you just close. So when you close, that's elevation. The protraction of the mandible, which is the interior plane of this, would be like this. And the retraction of the mandible, which is in the posterior plane, which would be bringing it back in. And the last one is the lateral excursion, which is side to side. So in the visual with a dislocated TMJ, they would come from something like this, like complaining about pains right by the ears, pain in their jaw, and it tends to worsen with movement. They may also experience difficulty speaking, and the usual cause of this is trauma to the jaw, which causes a dislocation.